why insurance rates are as high as they are. What really are the costs, the true costs of health care? Can it be regulated? Should they be?
One of the problems with healthcare today is it's enormously complicated to understand. And what I'm going to try to do here in the couple minutes that I have is explain one key piece to that. And that is, the government likes to talk about the idea that there are 40+ million people without insurance. As a practical matter, the federal government and the state governments in support of that have, since 1963, been complicit in the process of purposely causing that problem to occur. And the reason why is this. By underpaying the real true costs of health care for either the senior citizens, Medicare, the poor, Medicaid, or for the uninsured, by not covering them at all, it forces hospitals and doctors to raise their prices to the insurance companies in order to stay in business. The insurance companies turn around and raise their prices to employers. Some employers can't afford that, so they no longer provide insurance for their employees and they become uninsured. That's called the cost shift. It's a purposeful hidden tax that has been in place since the 1960s in this country. The federal government knows about it. There's been lots of testimony in front of Congress about that, but they never call it a tax. The truth that, as a practical matter, 30 cents on every dollar of healthcare costs is caused by the cost shift. And that's the only way that the hospitals, 90% of the hospitals in the United States are nonprofit. That means 100% of the money that they generate goes for healthcare, okay, one form or another. It's the only way that they can stay in business. And so is to cost shift that to the insurers, who then pass it on to the employers. That is an important aspect to understand about this whole issue. The government doesn't take responsibility for the 40 million people that are uninsured, yet they cause it purposely with the policies and the legislation they have passed in the last 4 years. Does it need to be regulated? Probably not. Probably what needs to happen is that the government needs to take responsibility for the constituencies that it has elected to take responsibility for and now wants to expand, Medicare and Medicaid, and pay the true costs. If they paid those costs of care, the average cost of health care would come down by 30% because it would eliminate the cost shift. The other point that I wanted to make is that there's a difference between 100% universal health insurance coverage and 100% universal health care. In this country, the laws are written in such a way that anybody can get health care at no cost if they present themselves to an emergency room of the hospital and say they do not have any money to pay. Under the law, hospitals are not permitted to turn that person away.
If they're in an emergent situation.
If they're in an emergent situation. But a lot of people use the emergency rooms as their only access to health care. So that's a big contributor to the cost shift, because that care is provided at no cost to the patient, no reasonable reimbursement, but it goes into the mix when they raise the price to the insurance companies. So in terms of education this evening, I just wanted everybody to kind of understand the complexities of the process, but the government itself creates its own problems and then won't admit that it caused this problem to occur, and doesn't come up with a solution that fixes the problem that they caused.
Thank you, Mr. Pescari.
What you heard about the Medicare cost shift is a very important concept to take away. If the government decided today to put money into that and relieve us from that cost shift, much of what we're working on would go away. But I want to focus on two quick things in the 47.5 seconds I have left, which is why are insurance rates what they are? Healthy people pay for sick people. That's the way insurance works. And by and large, our insurance industry has functioned very, very well. to allocate those resources, okay? But something we're going to have to take on ourselves. You heard the president say we want to bend the cost curve, but he didn't answer that. How are we going to bend the cost curve? The answer is in this room. It is not in a government program. Okay, it's in the fact that 75% of all healthcare expenditures today are for chronic disease, heart disease, cancer, diabetes. A large proportion, the doctor could probably give us a very good number on that, but 80% of heart disease, we're being told, is almost curable through tobacco cessation, diet and nutrition, and physical activity. So if we created a system that put incentives on that type of behavior, we would finally be affecting and bending the cost curve without the government fixing prices.
Amen. Amen.
Great, that's a great answer.
Ryan is right on with this, and there's a perfect example if you have not seen it yourself. Safeway has a health program for its employees, and it disincentivizes people if they do not have healthy lifestyles. If you are a smoker, you pay higher insurance. If you are diabetic and don't take care of your diabetes, you pay higher insurance. If you don't exercise, you pay higher insurance. They have got a total buy-in from their employees. They have been able not only to maintain the cost of their health care, they have cut it and increased benefits. That's what you can do with the program.
Amen.